I'm Dr. Melanie Palm from Art of Skin MD, and we're going to kind of continue our series on hand rejuvenation, and this time we're going to be using Radiesse, which is also known as calcium hydroxyapatite. It's FDA approved for facial filling, and a lot of us as cosmetic surgeons and dermatologists use it off the face to help rejuvenate the hands. So we have a lovely patient. We're going to do two little videos. This first one is actually going to be showing revolumizing using Radiesse. We're going to use a cannula technique, which really decreases pain for the patient and also decreases the risk of bruising following. I've mixed the Radiesse with a little bit of local anesthetic called lidocaine. That should make it even more comfortable for the patient. We did a little numbing bleb before we actually started this video, and I've made a little entrance spot where we're going to introduce the cannula in order to put the material in. So with that, let's get started. We're going to focus on the hand. There we go. All right, so once we've actually found that little spot, it was so tiny it took us a second to find it. You can see my cannula has been introduced, and it's in the subcutaneous space. So that actually means the space under the first two layers of the skin and the fat layer. And you can see by withdrawing, we're going to put a little bit of the Radiesse in between the tendons. And this over time is really going to help camouflage some of the veins. You can see that those veins actually already are starting to look a little bit more camouflaged. And we're going to come down into this area and fill in where she's lost some volume there. You can see this is nice and easy, and it's obviously comfortable for the patient. About halfway done, and you can see this is just really nice and easy. We put a little bit of topical numbing in the area that we were filling, but it's a really comfortable, easy, simple way to fill in that volume loss. I tell patients often that, you know, we take really good care of our faces, but we sort of forget some of the areas of our skin and of our body that actually show our age. And one of the most critical ones, I think, is the hands. And so in step one, we're going to revolumize the hands, and in step two, I'm going to show you a quick and easy procedure called an IPL, or intense pulse light, which is going to remove a lot of the brown spots. And we're going to take 20 years off of this patient's hands by doing these quick, two easy, simple procedures. So we're almost done. Now the last thing I'll do once we've actually put the filler in is to massage it into place, which I think is really important. So we're going to have the patient make a little bit of a fist for me, and we're just going to massage a little bit, which usually the patients enjoy. This feels sort of nice. I always start with just doing about a half a syringe on either side of the hand. I find if you do more, that swelling can be a little bit more pronounced. You know, with doing this quick and easy procedure, you can see there's been absolutely no trauma to the back of the hand. You can already see the revolumization, so the tendons are less visible, and even the veins are a little bit less visible because we've given some soft tissue support to that area. You know, by just doing a little bit at a time, I usually will reevaluate patients at a month. And by doing that just slowly and gradually, I think that gives a really nice gradual revolumization. Looks very natural, and you avoid the side effects such as swelling for a long period of time. And with that, you've got hand rejuvenation. All right, we'll see you next time.